So, morning everyone. Welcome to our South Yorkshire Bitesize series. I'm Natalie Wong. I'm Programme Manager for the South Yorkshire Innovation Hub, and today's session will be around children and young peoples as our key theme, which will be covered by a presentation from Julia Thompson from Sheffield City Council and Dr. Anna Engel from Sheffield Children's Hospital. And this will be all around the Sheffield Perinatal and Infant Mental Health Integrated Care Pathway. Presentation will be followed by Q&A, so please do bear with us and stay with us. The webinars in this series will highlight research and innovation best practice all across the South Yorkshire region and will run weekly from now up until January 2026. We've had some so far. So our September series was on cancer. Our current series on this theme was on, as I mentioned before, children and young peoples. And the following months will be on prevention, workforce and economic participation. Now, in line with the 10-year plan, we want to maintain the energy around innovation as a national priority. Innovation, as we know, drives progress, it enhances problem solving, and it also fosters growth, which will then forever support our health and care industry. We hope that you feel inspired by our speakers today and gain lots of insight into research and innovation delivery and can take away tips to use in your local workplace or system. Brilliant. Thank you, everyone. So thank you for filling that in. I will now pass you over to Julie and Anna.
Thank you very much for that, Natalie, and thanks everyone for joining the call this morning and being your interest really in the work that we've been taking forward in Sheffield. As Natalie said, my name's Julia Thompson. I'm a Health Improvement Principal in Sheffield's Public Health team, and I'll let Anna introduce herself. You can see she's just sorting out the technology.
Yeah, I'm Anna Engel. I'm a consultant clinical psychologist and I'm the clinical team lead for the Sheffield Parent-Infant Relationship Service, or PAIRS service.
Thanks, Anna. Do you want to move on to the next slide? So just to give you a little bit of background really to help you get a good understanding of where this piece of work came from. We have been working in Sheffield for some time on looking at how we could strengthen our parent-infant relationship offer and also support for parental mental health in the perinatal period. But it wasn't really until the Start for Life funding became available to us that we were in a position to really catalyse the developments that we wanted to take place to improve those positive parent-infant relationships and support accessible services. So the DFE funding came into Sheffield in 2022 and was extended last year until 2026. And we were one of 75 authorities who were selected to be part of the initiative. And that had been based on levels of deprivation and poor health and educational outcomes in our area. So as part of that vision, we really wanted to seize the opportunity to create a new innovative service model to improve parent-infant relationships and attunement, and to really understand how together we could support parental mental health in a very proactive way that particularly sought to meet the needs of people who are seldom heard. We were one of 4 funded work streams, and the perinatal and infant mental health work was the area that had the greatest amount of resource, which was a really great, good starting point for us. And in addition to the development of that service offer, we've also been looking at how we can improve the breadth and accessibility of information, but alongside think about how we could improve workforce knowledge and capacity. The governance for the work has been through the Early Help Strategic Partnership in Sheffield, but we also have a link through to the Health and Wellbeing Board. Next slide, please, Anna. So just to give a bit of background on where we were at before the investment of the Start for Life funding came into Sheffield, and I think it's fair to say that we had got the foundations of some effective working relationships, but in terms of a sort of concrete service offer, it was very minimal. We had no dedicated citywide provision for parent-infant mental health support, and though we had, again, a sort of training offer and a pathway approach that had been agreed by partners. There was no integrated provision that sort of allowed for onward referral if need was identified. So I think it's fair to say that, you know, the provision that we did have was quite fragmented. It really needed this investment of resource to help us create a more coherent model of support. And similarly with perinatal mental health, there was limited perinatal support available. We had a small amount of resource invested in mild to moderate mental health support through the council, but other than that, the provision was very minimalistic. No support for hard to reach groups or for dads or co-parents, and any specific provision for people who particularly had experience of developmental trauma were sort of excluded from support. So I think that, you know, we knew that we were starting from a very low baseline, and, you know, we're particularly concerned with understanding how we could create a universal approach, but one which embodied proportionate universalism. Over to you, Anna.
Okay, so we've known for many years now that the quality of early caregiving interactions and the development of secure attachment is pivotal to a baby's healthy development and lifelong outcomes. This knowledge provides us with a really precious opportunity for preventative support at the earliest opportunity, aligning with the NHS 10-year plan ambition to shift from treatment to prevention and national drivers around giving babies the best start in life. But as you just heard, support in Sheffield was lacking and fragmented. Knowledge about the importance of parent-infant relationships sat in isolated silos, and opportunities for early intervention and prevention were being missed. So the Parent-Infant Relationship Service, or PAIRS, and the wider pathway of support for perinatal and infant mental health began really as a conversation between public health in the local authority, specialist community CAMs and 0 to 19 health visiting about how we could make the most out of the opportunity afforded by the Start for Life funding to develop a comprehensive kind of offer for Sheffield families. And what emerged from these conversations was a set of guiding principles that have shaped our approach. And they are, firstly, to keep attuned relationships at the heart of how we work, whether that be between professionals and organisations or between professionals and families. We wanted to build a broad community of support in order to make the most out of every contact with families, every opportunity to reach out and provide support and share information. To be proactive and act as early as possible when we know that we can be most effective. And to apply the principles, as Julia just mentioned, of proportionate universalism to ensure that we use the resource wisely to ensure equitable and timely provision which reflects and meets need. So building on these principles, we've created a jointly delivered citywide pathway which provides consistent, connected and compassionate care. So how have we gone about it? And first off, how did we spend the money? Well, we wanted to invest in the parent-infant relationship service because, as Julia said, there was no specialist dedicated provision there. And that has meant that we've grown from a small team of 2 to a multidisciplinary team with a full establishment of nearly 12 whole-time equivalents. What we've done is we've brought staff from specialist CAMs and 0 to 19 health visiting together to form an infant mental health team that has a skill mix to offer support from conception to 3 across universal, targeted and specialist levels of need. We accept referrals through a single point of access and have no restrictions on who can refer into the service, and that includes self-referrals. We work with any primary caregiver to support their relationship with their parent, and including dads and partners, foster carers, kinship carers. And we offer a responsive, no waiting list model of provision to ensure that support is timely and accessible, because we know that babies can't wait. So key to the model that we developed for the parent-infant relationship service was infant mental health practitioner roles. And these practitioners are embedded across our health visiting locality teams. They were originally nursery nurses in the health visiting teams, and we have kind of trained them up in infant mental health and parent-infant relationship interventions and models. And what we found is that this places relational expertise where it can be easily accessed by health visiting colleagues, and it really has strengthened the links between universal and specialist care. So the infant mental health practitioners understand the diverse needs within their localities and share parent-infant relationship knowledge with the health visitors, who have universal access to families and trusted relationships with the communities that they serve. And so through this kind of increased connectivity with 0 to 19s, we've been able to directly improve the identification of emergent difficulties in the parent-infant relationship and support the health visitors to make early appropriate referrals into the specialist team. The infant mental health practitioners also provide direct support for families experiencing mild to moderate difficulties, which allows the CAMS clinicians in the pairs team to focus on those with the most complex needs. So relative to other parent-infant relationship services, we're able to provide support across a broader spectrum of need than most. In terms of our kind of perinatal mental health offer, we've expanded capacity with our perinatal mental health peer support, and that's enabled them to build a presence across all family hubs and community settings, and given them the capacity to develop targeted offers for disadvantaged parents and families from certain underrepresented BAME communities. We've also funded a tailored mental health peer offer for dads. In midwifery, we've increased capacity with a couple of roles into the maternal mental health midwifery team, which, as well as providing support to prospective parents during their antenatal journey, the team acts as something of a conduit between sort of time-poor community midwives and the wider offer of support. They're also central to a new antenatal care pathway that we've been working on to support parents who've experienced relational trauma through their kind of antenatal journey. And lastly, we've invested a small amount of money into developing a dedicated perinatal mental health role in the talking therapy service. And that really was aimed at strengthening the links between talking therapies and the wider perinatal and infant mental health offer. So I wanted to say a little bit about how we've gone about kind of connecting these services, both with each other and with pre-existing service offers for families in the perinatal period, to create this community of support that we were really aiming for. And key to this has been the ambition to sort of upskill and train all professionals who regularly work with families with babies and young children. So, for example, nurseries, peer support organisations, family hubs, early help, and our parenting team, so that they've got a basic awareness of what it might look like if a parent is consistently struggling to meet their baby's emotional needs, or that they themselves are struggling with their mental health, and that they also know how to help them to access appropriate support and what's available. To this end, we've now provided training, reflective practice and open consultations to over 29 organisations across health, local authority and the voluntary sector, building a shared language and building confidence in practitioners to notice concerns and act early. We are starting to see this have a really positive impact on referral patterns across the pathway. So practitioners are more confident about where to go for help, how to signpost, and how to secure timely input for babies and their caregivers. Warm handovers and co-delivery have also really helped families move between universal, targeted and specialist offers without losing continuity. We've also worked to ensure connectivity and smooth pathways between the pairs team and our specialist perinatal and mental health services, to ensure that there's really no wrong door, so that wherever families get referred, we're able to help families find their way to the service that's best placed to meet their needs. And one of the things that we've found is that day-to-day practice is becoming more centred on the baby's lived experience, and I think that's, you know, that's one of the consequences of having these conversations through the training and the reflective practice offers that we've embedded in the system. So citywide, colleagues report that they feel more able to consider relational risk alongside physical indicators when they're working to safeguard babies.
I think, yeah.
Go on, Julia.
Okay, thank you. So I think, you know, one of the things that we were really clear about from the starting point was that this wasn't just about delivering something new or filling a long recognised gap in how we were working. We could see that there was a real chance to develop a fully integrated offer which pooled the resources and expertise of a host of professionals and practitioners working within sort of statutory services, but also in the community and voluntary sector. And this slide sort of describes that ecosystem, and it's really been about developing a proactive, interconnected support offer that involves all those people identified around the slide, as you can see, focused on identifying and meeting needs at the earliest opportunity. Wherever possible, work is tailored to meet the unique needs of individual families. And as we said, there is a focus on inclusion and the supporting marginalised or disadvantaged communities. I think it's fair to say that many of the families we work with experience both and or social material deprivation. And so wherever possible, it's been really important to seek opportunities to link parents into appropriate support, whether that's welfare, housing or something else that helps them make progress and focus on meeting their own mental health or parent-infant relationship needs. The pathway has been supported by a really comprehensive workforce development offer, and that's been very significant in equipping professionals who are regularly working with families, including staff and in the health sector and also local authority and community organisations, with the skills and confidence to identify needs and to provide ongoing access to support. The training offer includes parent-infant relationships, perinatal mental health awareness, and trauma-informed, trauma-reducing care in the perinatal period. Another element that I think has been important in securing that ecosystem has been the creation of a comprehensive range of information resources for professionals and parents, which has been co-designed with people with lived experience, and is helping to develop an understanding of what the integrated care pathway can offer and the services available. The resources are available both digitally and also in a physical format, so leaflets and Z cards, and you know, give professionals working with families face to face the opportunity to provide them with information there and then in a consultation. There is also the ability to translate a number of these where that's necessary. Next slide, Anne, thank you. So we just wanted to spend a little bit of time providing a kind of a spotlight into some of the key developments that we have been putting in place as part of the suite of interventions that services are delivering. Getting in early in the antenatal period has been a really critical starting point for much of our work, and we've developed a proactive offer of support for parents who've been identified with by midwives as having mild to moderate mental health difficulties. So the emotional wellbeing clinics are offering a joint initiative which is being provided by the Family Intervention Service that is part of early years in the local authority, and also maternal mental health midwives. And this is an opportunity to listen to the needs that parents might have over and above their sort of clinical sort of needs in the antenatal period, and offers sort of extra help for parents identified between 16 to 24 weeks antenatally as in need of additional mental health or wellbeing support. Part of that offer also includes a mental health passport, which documents key information about their experiences, needs and preferences, and that helps them stay in control really of the consultation and the discussion about their mental and emotional well-being. I wanted also just to give you a bit of information about the perinatal mental health counselling pathway that the peer support charity Light are offering. Light offer a free service to parents already engaging with the service for perinatal mental health peer support, and this is provided through supervised counselling placements, which are provided to the fourth year therapeutic counselling students as part of their final year of study. And their work is overseen by a lead integrative counsellor who provides managerial and supervision support to each of the volunteers. So it is very much part of a structured programme that has an interface with statutory provision. The feedback that we've been getting from parents who have been able to access that service has been really positive, and they often receive around 9 sessions of therapy, which gives them a real opportunity to go into some of the more specific sort of strands of their need that perhaps aren't necessarily appropriate to cover in the context of sort of traditional peer support. The clients that have been feeding back on this experience of that always indicate that the mental health has improved since they started therapy, and it's helped them feel more confident and have a better understanding of how they can cope with their feelings and improve how they deal with problems. I think it's also important to say that counselling offer is also available to dads.
I'm just going to run through the next 2 kind of developments, starting with the parent-infant relationship question project. So this project was initiated in response to feedback from health visitors who reported that they weren't confident in using the existing Start for Life attachment questions. And the attachment questions are prompts really for health visitors in particular, but others, to use in to begin or initiate conversations with parents and caregivers just about their relationship with their baby. The health visitors were saying to us that they felt that the questions often felt quite awkward to ask, that families were unsure how to respond, and in particular that those with English as a second or other language found them particularly difficult to engage with. So we did a really nice piece of work listening to families and health visitors across all localities in Sheffield, including the health inclusion teams and the specialist link workers who support Sheffield's sort of seldom heard communities. And with them, we co-designed more inclusive, strength-based prompts to replace the existing questions. The new questions were piloted and they were sort of designed to complement the antenatal promotional guide, which were already sort of embedded into health visiting practice, so that it felt like more connected with their existing practice. So this has happened quite recently over the sort of summer months. We trained 133 of the 166 practitioners in the health visiting teams in the use of the new prompts during antenatal and postnatal sort of healthy child programme visits. And we're now partnering with the University of York, who are involved in a study called the SPIRE study, which is evaluating how the use of the prompts impacts on identification of need and referrals into parent-infant relationship support offers. So that's a really nice and exciting piece of work that's come out of the project. And the last project we wanted to spotlight is called Art at the Start. And we launched Art at the Start for Sheffield in response to a citywide survey that we did which identified stigma, location, and accessibility as key barriers that families were saying prevented them from seeking parent-infant relationship support. So stigma, location, and accessibility. And art at the start, I think we're hopeful that art at the start might address some of those concerns, as it's a creative, evidence-based programme that helps parents and babies connect through shared art activities, and it can be done in welcoming non-clinical spaces. So what we've done is we've trained over 50 professionals across health, education, early help and cultural sectors to build capacity to deliver a tiered approach across the city. So the tiered approach is that we have universal one-off kind of drop-in open sessions that happen in family hubs and community venues, including the museums and galleries in Sheffield. We also have a more targeted 3-session programme that's happening in early years and local authority settings that really focuses in on social communication development. And then we have closed specialist therapeutic groups that are delivered by the Pairs Service for families with more complex needs. And with Bright Young Dreams, which is the Sheffield Children's Hospital charity, and the University of Dundee, we're establishing a 4-year PhD studentship to study the impact, and we're looking to develop and test a promising new observational measure as part of that work. Back to you, Julia.
Thank you. I'm not going to go into each of these little boxes, but I just wanted to give you an insight into some of the impacts that have been achieved through this work. And I think, you know, it's really clear from the data that we're collecting from services and from people who are receiving support that we're showing really effective progress in the areas that we identified as our priorities. And most importantly, I think, you know, people are being identified earlier, they're being seen earlier, and staff are clearly equipped with the skills and information to spot need and make quick referrals, which is great. I think that helps us to feel confident that what we're doing through the pathway is improving access and also reach, and we're making links with individuals and organisations who might previously struggle to access some of these forms of support by building trusted relationships with communities, and really looking at how we can overcome some of the barriers that we know traditionally are in place that, you know, sort of hinder people's access to support. I think the other thing to say is that, you know, services are really recognising, I think, that, you know, they're being well received by parents, and we're seeing pleasing improvements in clinical measures and self-reported well-being of parents, and that includes both the sort of clinical services that are on offer and also the peer support offer. So, you know, we're confident, although it's early stage, that this is going to have a really long-term benefit on outcomes for our population and families in Sheffield. Next slide, please, Anna. In terms of sustainability plans, obviously, you know, we are currently reliant on what is a short-term funding stream, and, you know, we're really, really clear that we want to sustain and develop on the great progress that we've been able to make so far. The areas that we've focused on are continuing to be really looking at how we can train and upskill the wider workforce, and develop new connections with other services such as primary care, social care and adult mental health, to really harness this work in a very strong partnership that has a long-term impact. We are clearly looking at how we can demonstrate the effectiveness of the work that we're taking forward with our health and local authorities, so that if events of Start for Life funding not continuing, there is a recognised commitment that this work will have longer term benefits for the city and the outcomes that our statutory organisations are wanting to achieve on behalf of the population. We're looking at ways to ensure that service guidance and standard operating procedures are developed that allow us to continue to implement the new ways of working and the new pathways of support that can help us sustain the care pathway approach, irrespective really of the scale, although obviously our intention is to maintain the capacity at the current level. And we're also making sure that there is a really comprehensive digital support offer that allows us to regularly update and maintain all the resources and materials that have been created for professionals and parents. We're looking at other individual strands of work, including a community of practice for dads and co-parents that's going to build on the developments that have been instigated through the programme activity. And we also have an active perinatal mental health and infant parent mental health steering group to oversee our strategy and associated delivery plans. And then I think finally it's important to make the point that, you know, we're recognising that this work is having a long-standing impact beyond the confines of the Start for Life programme, and attuned parent-infant relationships are absolutely at the heart of major strategic transformational plans in the city around healthy child development, and looking at how demand for services such as CAMS and special educational needs can over time be reduced through early intervention. And that's it.
Set that we wanted to leave you with a video. So this is a parent who's accessed the PAIRS service on 2 separate occasions, and it's just a short video of her telling you about her experience and the impact it's had.
I'm Leanne. I've got 2 children, Skylar 4, Willow 3. I was first referred to PAIRS from perinatal service when Willow were born. I did the work, felt I got to a place I needed to be, but then later down more challenges come up and I thought, oh, I felt very different towards Willow than I did Skylar, and it bothered me massively. The connection weren't the same. There were behaviours that triggered me. There were a lot of differences. We weren't really cuddly and affectionate to each other. It was very kind of arm's length relationship. I made me feel really guilty, sad, ashamed. But it weren't a choice. You can't help emotions and feelings. I wanted it to change, and so I did a self-referral and I got in touch with PAIRS myself. We did like a lot of play together. When Willow were doing certain things, you were asking questions, which made me really concentrate on what were actually happening as opposed to what my mind wanted to think were happening, and that really helped. I took a bit of time for myself, which I felt really guilty for doing at first, but now I take time for myself, which has really helped. You feel better in yourself, which means you feel better in your parenting, which means your kids are going to feel better because they're going to notice. It's made me confident in them actions. I'm more attentive, I think, because I'm seeing Willow and her needs rather than something completely different.
And that's it.
Thank you, Julia. Thank you, Anna. That was incredibly insightful. And I think, if anything, your presentation has shown us how invaluable this service is, especially around the pathways. And it's really great to see that there's things there for dads as well. And often I think it's either kind of the mum or the infant. And actually this feels like a really, really good combination of everyone. So it's great to kind of see the inclusivity there, but also the support of kind of improving health inequalities. It's brilliant work. So thank you so much for sharing. So for our Q&A, starting off, we have a question from Adam. Thank you, Adam. So is physical activity, movement and access to outdoors promoted at all as a way to support relationships and mental health, both for children and families? Adam leads a programme around Active Start 0 to 5 across South Yorkshire through ICB funding, and they've just launched their report recently.
Shall I come in there, Anna? Yeah, I mean, it's a really good question. Thank you for that. And we have, as part of the peer support offer, really considered the way of linking physical activity and mental well-being. And one really strong way of doing that has been in work with people from Muslim communities who I think particularly have really found it difficult to feel confident that, you know, a peer support mental health service is appropriate for them or meets their needs. And I think have found the offer of walking groups a really great way to sort of feel less scrutinised, but, you know, have a chance to talk more openly about, you know, how they're feeling. And, you know, it's been a great way of them, you know, being able to get out in the fresh air with their children, but also, you know, have that access to a conversation to help them understand how, you know, the problems can be overcome. And I think similarly there has been some work that the Steel City Dads initiative, which is the peer support programme for fathers and co-parents, they've offered things like walks on the Longshore estate near Sheffield, you know, for dads, and, you know, I think have been really proactive in thinking about ways to get out and about and, you know, actively engage parents rather than having them sitting in a, you know, family hub to receive support. So they're the immediate things to come to my mind.
Thank you. Thanks, Julia. We've also got a question from Richard. Thanks for your question, Richard. So this is great and a much needed service for the community. Is best practice shared with other local authorities, such as places in South Yorkshire? Barnsley also offer fantastic perinatal support.
I mean, we certainly made a point, I think, of recognising the relevance of, you know, cross border working, because, you know, obviously a lot of our families, you know, may be receiving different forms of support from different areas. You know, they might be booked for maternity care in Sheffield but live in Barnsley, for example. So we do have quite good partnership relationships through the maternal and neonatal partnership, the LMNS. And I know certainly that we work through the perinatal mental health specialist network and share information about the work in the family hubs, but also the parent-infant relationship support as well. I don't know if there's anything else, Anna, that you think it would be helpful to add.
No, I mean, I think we'd be really keen to kind of have sort of more conversations with kind of other areas in South Yorkshire, and we have kind of raised the issue that although other areas are doing their own thing, there is a kind of inequity, I guess, in terms of the provision across the region, with our colleagues in the ICB. But it's how to sort of take that forward, I think, remains a bit of a question.
Thank you both. I'm just looking through the chat. I'm conscious of time, so I guess last follow-up question from me. I think it's quite evident that a lot of the work that you've done within this pathway and service is based on feedback and based on kind of population needs. When it comes to kind of reaching out to local communities and kind of those with lived experience, has that been quite an easy way to kind of collect that data and support that continuous improvement of services?
I mean, I think that, you know, we've made a particular point of seeking opportunities to get feedback from people with lived experience to really inform the quality of what we're doing, and make sure that, you know, we sense check the development of the care pathway and the different interventions. So there's been several ways that we've been able to do that, including having focus groups, offering surveys, you know, thinking about ways that we can have expert advisors working with us to develop resource and materials, because we recognise that sometimes, for all the will in the world, it's really difficult for parents to feel confident and comfortable to express their personal experiences. But I think that's where, for example, the work that Anna and the PAIRS team have done in creating videos and similar materials has been important and helpful in sort of sharing that perspective.
Thank you both. Thank you. So that is our Q&A. So thank you all so much for attending. All of our bite-sized webinars, as mentioned before, have been recorded today and will be uploaded onto our South Yorkshire Innovation Hub website for you to then share with colleagues and to also watch back yourself. This webinar, again, as I mentioned before, is part of a whole Innovation Hub bite-sized series. The sessions are all free to attend. We'll be running them up until January. But again, if you want to book onto any sessions, I will bob the link in the chat for yourselves, just so you can book on in the future. Thanks again for everyone for attending. Really appreciate it. Take care. Thanks. Bye.